The topic of today's video is heart valves. The heart beats over 100,000 times a day. But have you ever wondered how blood always flows in the right direction? The answer lies in four incredible one-way gates, the heart valves. The heart has four valves, two atrioventricular valves, the tricuspid and mitral, and two semilunar valves, the pulmonary and aortic. These valves make sure blood flows forward and never backward. The tricuspid valve sits between the right atrium and right ventricle. It has three cusps supported by caudate tendineae and papillary muscles, which stop it from flipping backwards when the ventricles contract. You can see the location and structure of the tricuspid valve in the diagram on the right. On the left side of the heart, the mitral valve, also called bicuspid, has two cusps. It works the same way, allowing blood into the left ventricle during filling, then closing to stop backflow into the atrium. You can see the location and structure of the mitral valve in the diagram on the right. The pulmonary valve lies between the right ventricle and pulmonary trunk. Its three semilunar cusps open during ventricular contraction and close to prevent blood from flowing back into the ventricle. You can see the location and structure of the pulmonary valve in the diagram on the right. The aortic valve sits between the left ventricle and aorta. Like the pulmonary valve, it has three semilunar cusps, opening during systole and closing during diastole to keep blood moving toward the body. You can see the aortic valve in the diagram on the right. The valve cycle or blood flow regulation. Valves don't open by muscle power. They open and close due to pressure differences. During diastole, atrioventricular valves open to fill the ventricle while semilunar valves are closed. During systole, atrioventricular valves close and semilunar valves open to pump blood forward. Clinical relevance. Valve problems can cause stenosis, which is narrowing that makes blood flow harder, or regurgitation, where blood leaks backward. Faulty valves can create abnormal sounds called murmurs. In summary, the atrioventricular and semilunar valves work in perfect coordination, driven by pressure changes to keep blood flowing in the right direction. Without them, circulation would collapse. So the next time your heart beats, remember it's the perfectly timed dance of the atrioventricular and semilunar valves that keeps blood moving efficiently through your body. Without them, circulation would simply collapse. Thank you for watching. If you found this video helpful, don't forget to like, share and subscribe for more medical education content. Stay curious and keep learning.